As part of the Ministry of Health and government's effort to retool health facilities and to improve healthcare delivery across the country, a CT scan machine was donated to the Eastern Regional Hospital in Koforidua in 2013. This machine was put to good use by management of the hospital, but in January 2021, it developed a fault. When Citi News first reported about the faulty CT scan in January 2021, management of the hospital explained that engineers working on the faulty equipment say the tube which emits the radiation for the pictures to be taken is completely exhausted, and once that happens, the machine is good as dead. Citi News' second report on the faulty CT scan was in July 2021, after victims of an accident which occurred on the Accra-Kumasi Highway were referred to Accra for CT scan procedure. Again, management told the news team letters had been sent to the Ministry of Health about the urgent need for the CT scan to be replaced. They added that the Member of Parliament for New Job in South Constituency, Michael Kofi Ochrebefi, now Deputy Minister for Trade and Industry, who was copied in the letter, promised to do something positive about it. But on September 29, 2021, when the news team again went to the hospital for an update, it was found out that the problem has not been resolved. A year and month down the lane, and the Eastern Regional Hospital, which is the referral center for all health facilities in the 33 districts of the Eastern region, is still without a functioning CT scan. The medical superintendent, Dr. Akun Akoto Ampao, at a media engagement, expressed frustrations about how the faulty CT scan is affecting quality healthcare delivery.
As for the clinicians, they would need a CT scan to make a diagnosis. So we do refer these unstable patients to Accra. However, if it is that a vessel is burst and is bleeding, we give medicines that will clot the blood. The only way you can see those two differences is to use a CT scan. So if a CT scan is not available, how are you going to know whether you give medicines that would thin out the block or you give medicines that would coagulate or clot the blood? And that is how come it's very important. You can also relate that in such patients, they really are very unstable, and to travel all the way to Accra just to have a CT scan and come back is really pressing on them. And that is how come at all cost, with you around, we know that the world do hear that we really need the support.
The Koforidua Central Hospital is not the only health facility in the region without a functioning CT scan. The SUM and some government hospitals also do not have CT scans. Sadly, the Eastern Regional Hospital's Nanogram is also out of order.
It's broken down because the elements that generates the imaging has been consumed, but the machine itself is in good state. However, like I mentioned, the cost of that element is so prohibitive, we must as well get a new CT scan and even possibly upgrade from a 16-slide CT scan to a 32 or 64. The cost of procuring that is also very high, would appeal to philanthropists and any organization, including the government, Ministry of Health, Ghana Health Service, to come to support us because it's very important in helping make pinpoint diagnosis in the management of patients that come to the hospital.
Dr. Akun Akoto Ampao called on contractors who have just begun the construction of the new Eastern Regional Hospital on the Koforidua-Akwadum stretch to speed up work and hand it over for use to lessen huge cost of maintaining the over 70-year-old Central Hospital.
Overall, this hospital, we say, is a very old hospital, 95 years old and still counting, but our structures are highly maintained. The challenge of maintaining old structures is the cost involved, and that is how come in most areas, once the thing is as old as what it has to be, they decommission to commission a new one. Besides the buildings and the structures, our vehicles are also very old. I mean, the newest vehicle probably is more than 7 years old, which must be decommissioned by the use of the high use of an institution.
The life of patients who are referred to the regional hospital for CT scan procedures will continue to hang in the balance till the malfunctioning CT scan is replaced.